My field of family medicine is one in which I see all age ranges. I've spent my career taking care of everybody from small babies to our geriatric population, and that lends itself to lots of new learning and new challenges every day. I also really felt strongly that health is part of the family unit, and if you know the family and you know the family structure, and you can work with everybody together, then you're going to make a much bigger impact on health overall. When I first meet my patients, I like to get to know a lot about them, and that includes their past medical history and when they've been in the hospital and whether they had a car accident, their family history about what happened with their parents and their siblings. But it also includes what they like to do for fun, and what their dog's name is, and what they do when they're at work, what they do when they're not at work, and how they spend their time. I think it helps me get to know my patients as people, and that makes that relationship really special. I think unless you understand where a patient is coming from, it's very hard to understand what factors play a role in their health. Whether it's challenging to obtain medications, whether it's a challenge to get to doctor's appointments or get off work, or figure out how to get children to their well checks because they're in school and daycare. Knowing those things about my patients helps me work with them to achieve their health goals. I mean, if you don't want to get out of bed in the morning, it's not going to feel very compelling to do the things that are important for you. So, all of that really is a big part of the picture of taking care of patients, and doing it in a way that's meaningful for them, as opposed to what we feel like is the right choices.